Hello, welcome to Intimate Journey Birth and Wellness. I'm so glad that you chose me to be your midwife for this journey, and I can't wait to make your birth dreams come true and enjoy bonding with you and your family during this incredible journey of transformation and information. And I am so grateful that you chose me. And this video is basically to inform you of how my practice is run, how to get a hold of me, all the informational topics of what to help with as you progress through your journey with me. So let me know if you have any questions afterwards. Okay, first thing, how to contact your midwife. I will be sending you an invitation in the client portal, which is client care. It probably will go to your junk email, so make sure and check that. It'll give you setups instructions to make an account. And the best way to contact me is through that portal or by phone. It's HIPAA compliant, and the best way to reach me at all times usually. The office number is 805-548-0606. My personal business cell phone is 805-270-4466, which I will be giving you in your client binder at your first visit. So you'll have that information to be able to contact me when you need to. Okay, first thing, do not text me. It's a rule that I follow for myself for boundaries, but also because it's not HIPAA compliant. I ask you to message me in the client portal for non-emergency questions. I usually respond pretty quickly. I do have a pretty busy clinic day, Tuesday, Wednesday, Thursdays. So if you don't have an immediate response and you need to get a hold of me, please call me. I don't spend a lot of time on my phone. So if you're trying to text me, I will not respond because it's for a medical reason. It needs to be in the portal. So I really appreciate your respect on that matter. It really helps everything work smoothly for my practice. Okay, reasons to contact me or your midwife. I will also give you a binder with all this information, but these are really important reasons to call me. I'd much rather you call me for any of these reasons than end up in an ER somewhere. I'm your provider. Can help you with a lot of things and hopefully avoid you going to an ER or an urgent care. So these things are high fever over 100 degrees, severe persistent vomiting, severe diarrhea, dizziness or fainting spells, pain, burning, or difficulty urinating, vaginal bleeding, unusual vaginal discharge, unusual swelling in your face, hands, or fingers, blurred vision or spots before your eyes, sore, cracked, or bleeding nipples, obviously that's postpartum, severe or long-lasting headaches, unusual severe pelvic cramping or abdominal pain, difficulty breathing, and a decrease in your baby's movements after 28 weeks, which normally is 10 movements within a 2-hour period, once a day. All of these things are things that we screen for during your prenatal visits and making sure that you're safe. And so these are things that you should watch out for as well at home. So another reason to contact me are signs and symptoms of preterm labor, which are pretty rare, but they do happen. And this would be anytime basically second trimester to early third, regular tightening or pain in the lower abdomen or back, any bleeding in second or third trimester, fluid leaking from the vagina that you suspect is not urine or just runny discharge, and pressure in your pelvis or vagina with all of those things happening at the same time. A lot of the time, preterm labor can be caused from a UTI that you don't know you have because you're already urinating quite a bit, or you've been doing too much or too sedentary. So usually you want to do the opposite and drink a bunch of water, and usually that tightening or pain in the abdomen stops. So for any reason, like I said, make sure and call me. If you can't get a hold of me and it's an urgent matter, you should try to go to the emergency room or 911. Nutrition. This is a very, very important topic that we cover throughout your whole pregnancy. Proper nutrition is the best preventative treatment for conditions such as gestational diabetes, hypertension, preeclampsia, and many other problems that arise in pregnancy. If you are doing proper nutrition, that is your base. That is how you're going to function the best. Sometimes it's hard because we are trained and taught from the beginning that you're eating for two and you must eat more and more food, and it's okay if you want all those sweets. Well, it really affects you and it really affects the baby growing. Even after they're born, it affects them. So we really try to emphasize that in our care. Hello. So I give you a binder rental that I give all my clients, and it has all my handouts and information that we go over all through your pregnancy. I ask that you kindly return it at your last postpartum visit because I recycle them and use them for other mommies. It is basically broken up into 5 categories: nutrition, mind and spirit, important decisions, birth, and postpartum healing in your baby. So all of the information is divided up. You know all the things that you can prepare for with birth. Also, we go over nutrition handouts, and I'll give you kind of the tour at your first visit. But most importantly, goes over how much you should be eating, how to manage your stress levels, which is super important, and how to have faith in whatever practice you believe in, and how to take care of your baby, breastfeeding, and all the proper healing that it's normal to take care of yourself when you just give birth. So, hope you enjoy. Okay, so nutrition. We will go over this a lot in your visits, but most important, I want you to know foods to avoid: alcohol, caffeine. A little bit's okay, 200 milligrams a day if you really like your cup of coffee or you really like your cup of tea. Corn syrup, soda, raw, large fish. A little sushi is okay. I always say just as long as it's from a good source. Same with raw meat. It's okay to have a medium rare steak. It's actually really great for iron building, but just make sure that you're getting all your food from a really good source, because the whole process is they don't want you to get a bacteria that will make you or your baby sick. That's the whole meaning that for foods to avoid. Also, foods to consume. Very, very important to shoot for 100 grams of protein every day, which is relatively easy if you have 3 meals a day plus your snacks. So make sure your snacks have some protein and each meal has a good amount of protein, and then it's relatively pretty easy to get that 100 grams. The reason why is because your baby is building up all of their muscle tissue, brain tissue. Everything is amino acids, which is protein. That is really important for building the building blocks for your baby, basically. And then fats are basically fuel for you and your baby, and also great for brain development. So coconut oil, olive oil for cooking, avocado oil, butter, eating avocados, whole milk, nut butter, and ghee. So those are things that are great. And then greens and veggies, meat and dairy should be organic if it's possible. And then supplements, methylated folate, especially in the first half of your pregnancy instead of folic acid. I prefer a food-based prenatal vitamin because your body will absorb it better. Minerals, usually mamas are low in magnesium and calcium, potassium, so those are a good thing to have in your diet. Also iron. Later in pregnancy, your iron may drop a little bit, so I'll recommend some iron, but iron-rich foods are great to incorporate. Eggs are amazing with choline and brain development for your baby, so if you love eggs, please, you can't get enough of those. And then vitamins B6 and B12 are helpful as well. So enjoy all those good foods. All right, so important thing, we have babies that like to come whenever they feel like it. So I recommend, it's rare that we have to cancel clinic, but sometimes we do because of unexpected births in the middle of the night. So always check your messages, emails in the morning before you come to your scheduled appointment, just in case we message you about rescheduling. It may be in the middle of the night at 4 a.m. I have to text you, or not text you because I don't text, right? I have to message you in the portal telling you we had an unexpected birth, we need to reschedule. And I usually reserve one of the days during the week to kind of for overflow for that reason. So thank you for understanding. Thank you for heads up for that. Appreciate it. And you'll appreciate it when it's your turn to have a baby that people would be rescheduled for you too. Okay, so book recommendations. My favorite is Real Food for Pregnancy from Lily Nichols. She's a really amazing dietitian who knows her stuff big time. So that would be number one. We also have a lending library at the birth center. You're welcome to browse through the birth books and borrow whatever you want. And we highly recommend the Natural Pregnancy book by Aviva Romm. She's also another favorite of mine. So much information, and it also answers so many questions in your pregnancy, like why am I experiencing this? What do I do if I have a headache? All of those things, you can just go in her book and get your answers. So it's really a great tool to have. I love an Ina May's Guide to Childbirth. That's wonderful. The Bradley Way is another good one to prep for labor. And the list goes on, so we'll share those with you too. I put podcast and Instagram recommendations there. I don't have any off the top of my head, but we can definitely discuss that later. Okay, so Client Care Portal tour and instructions. So you can see right here, this is a fake account. This is what it's going to look like when you get in there to fill out all your information. It'll have basically your name and your partner or husband's name at the bottom. This little camera means you can upload a cute little picture of you and your family. We love to see you when we open up your chart. So fill out all the contact information. You'll also be able to see all of your appointments there, as you can see there on the right, and also alerts of any kind. Your health history tab, that is something you'll have to fill out before your visit. So all of this needs to be filled out before you come for your first visit. Health history is really important. Make sure and save everything you fill out. The message center is where you'll email me whenever you need anything. Your forms and records will be laid out. They will all be orange dots when they need to be signed. And they will turn green or yellow when you sign them. If you have any problems signing them, sometimes phones are a little finicky with it. Sometimes computers can be easier, but all of those need to be signed before your first visit as well. The birth certificate tab, eventually everything you fill out in the contact info here will transfer to the birth certificate, but there's also info in there that isn't listed. So that's important to have later on. And yeah, that's basically all that I can think of. You also have under forms and records, you also can access all your records from your prenatal visits, lab work that we do, and ultrasounds that'll be in there, and birth records and everything. So you have access to your records, which you should at all times. And so all of these things, please, please, please have that done before our first visit. It makes the visit a lot smoother. Appreciate it. If you have problems, let me know. Okay, FYI on fragrances. So please, it is our policy at the birth center that we strive to be a fragrance-free facility. So please refrain from wearing perfume, artificial fragrances, even strong essential oils can be hard for certain people. Mothers and babies are also very sensitive at birth. Pregnant noses are very sensitive. And I'm very allergic to chamomile essential oils, and my student midwife's very allergic to lavender. And so even though it's natural and I wish that I could partake in those, we have hypersensitivities, and strong perfumes cause a lot of headaches for me and my staff. So please respect this, and also tell anybody that's coming with you to the birth center that we do have this policy. I really appreciate all of your efforts to come with free unscented things. Appreciate it. Thank you so much. Thank you so much for listening to my video, and congratulations again on your growing family. I can't wait to see you and watch your belly grow and watch your family grow, and I wish you all the luck and look forward to seeing you and working with you soon. Have a wonderful, blessed day.